We are WGBB, the station that serves your community.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. We have a great show for you tonight, something a little different. We have our special guest, Dr. Ron Haas. Dr. Haas is a prosthodontist, and Ron, I want to welcome you to the show.
Thank you, David.
It's great to have you here. So, first, I think the question on all our listeners' minds is, what is a prosthodontist? So, what is a prosthodontist?
Okay, well, the reason you have to ask is because a lot of people say that a prosthodontist is one of the best-kept secrets in dentistry. Most people have no idea what a prosthodontist is. It's actually one of the 9 specialties that are sanctioned by the American Dental Association. It's the specialty that is in replacing and restoring teeth. Basically, we use crowns, bridges, dentures, and implant bridges to solve a variety of problems, especially difficult dental problems.
Mm-hmm. So how is what a prosthodontist does every day different from what typical family dentist does?
Well, we have a number of excellent family dentists on Long Island. We're fortunate to have that. If someone has a problem with 1 tooth, 2 teeth, a few teeth, needs a cleaning, family dentistry, the dentists do a fantastic job. When someone has many, most, or all of their teeth that are unfortunately missing, broken down, infected, decayed, or shifted, they have much more difficult problems. What happens then is frequently it affects the appearance, frequently affects the bite relationship. They can't chew as well as they used to chew, and now they need a higher level of treatment. Someone to restore that appearance, to restore that bite. That's what a prosthodontist does with their specialty training.
Now, you were telling me before the show, I mean, everybody knows an oral surgeon or a periodontist or an endodontist, but there are really very few prosthodontists on Long Island and in the country. You were telling me beforehand. How many are there? Yes,
well, there are very few. There's approximately 1,500 in the whole country. On Long Island, it's hard to say, but you can look down your street, and when you can see many dentists on many streets, you're not going to find many prosthodontists in most areas.
Why do you think most people have never heard of a prosthodontist?
Most people have never heard of a prosthodontist, I believe, is because it hasn't caught on as much as periodontics, endodontics, orthodontics. Most people are aware of those specialties. Most people are not aware of the specialty, and what we do is very similar to what a lot of dentists do. So most dentists will do what we do, and a lot of times some people might push the envelope on the more difficult cases, but fortunately many dentists will refer cases that are more difficult over to our office, but the patients usually don't know themselves.
So really your training is, it sounds like what a general dentist learns in dental school and what a dentist does at the end of their capability almost is where you take over in terms of the more difficult cases, the more challenging cases.
Yes, that's true. What happens is a lot of people go to their dentist and they realize that it's much more complicated than what they were able to do, and they will send the patient over. And then there's also the patients who have actually been treated by other dentists and they're still not comfortable, still not happy, can't get comfortable, and they end up coming to our office.
So who should see a prosthodontist?
Basically anyone who wants to be treated by a specialist. Anyone who wants to be treated by a specialist, but especially someone who has these advanced problems. Like I said, 1 or 2 teeth you have a problem with, you don't necessarily need a prosthodontist. But if you have many, most, or all of your teeth, but especially if it's affected your chewing ability, your daily comfort, basically you can't go through a day without thinking about your teeth in a bad way. It's affected your appearance, you're embarrassed to smile, and it's affected everything in your mouth.
So basically, simple, straightforward dental problem, 1 crown, 2 crowns, small bridge, that's the kind of thing a general dentist, that's their bread and butter. But for you, it's really the complicated cases, the full mouth rehabilitation, every tooth has a problem. That's really your focus, your specialty, and your training.
Yes, that's what it is. And for the people who want everything to be very particular one way, in other words, what I like to say about dentistry like this is it's easier to do full mouth dentistry get an okay result, but to get an excellent result and get the best appearance and the best result, it's quite difficult, and that's what the training is all about.
Well, let's talk about that. What type of training does a dentist have, and then what do you need beyond that to be a prosthodontist?
Well, first, to be a dentist, you basically go through 4 years of college, 4 years of dental school. And then after dental school, to become a prosthodontist, you need 2, sometimes 3 or 4 years of extra training to become a prosthodontist. And during those years, basically all you do is you learn how to handle the more complicated cases.
So it kind of takes the building blocks from dental school, the simple stuff, and then learn how to do the complicated things. Really the same things, crowns, bridges, dentures, but on a much bigger scale, much more difficult scale.
Absolutely.
So do you ever get cases now that you look at and you say, I don't even know how to approach this. I don't even know what to do. Or does that not happen once you're a prosthodontist?
You know, it can happen when you're a prosthodontist. It happened more a number of years ago when I was first starting out. But between over 20 years of practicing and over 20 years of teaching at North Shore Hospital in Manhasset, Stony Brook University, seeing many, many, many cases. And fortunately, that's very, very few and very far between when I get those cases.
Okay. Now, not that many dentists teach to the level you teach also. What exactly do you do at Stony Brook?
What I do is there's an advanced general dentistry program, a general practice residency program. And in that program, the dentists are doing more advanced treatments that they would not be able to do on their own. Mm-hmm. And they have lots of advanced treatments to do. And when I come in and the other specialists like myself will come in, we're able to guide them. We're actually able to teach them to handle more advanced cases. And this is actually a good example of many dentists can treat the more advanced cases, but they have to go out there and get the training. And it's much more difficult. You have to spend many more years and travel to many different courses and to get the training. So if the general dentist has the training, they could do it very nicely. If they don't have the training, it's best for them to refer.
Mm-hmm. Who's your typical patient? Who should see a prosthodontist?
Like I said, there's our typical patient is either older or younger. However, what a lot of people do is they don't make their teeth a priority. They don't make themselves a priority while their children that are at home. Once the children leave the house, then it's time to focus on themselves. They're not eating as well as they'd like to. They may have missing teeth, broken teeth, problems with their teeth. They were waiting for their children to leave the house. Now it's their turn. They come in. They want the smile they've always dreamed of. They want to be comfortable. They want to chew. They don't have to worry about dentures. We do wonderful dentures. But fortunately, these days with implants, most people can avoid dentures, which is nice.
Do you ever see people come in who they dump a box full of bad dentures on your desk and say, fix this. I can't stand these things. Is that a common thing that people have ill-fitting dentures?
It's funny you could say that because that's the classic patient that usually sees a prosthodontist. Absolutely. Dentures is one of those fields that for many people it's relatively basic and more simple to provide. But for certain people, due to the shape of their gums, the shape of their remaining jawbone, they have a much more difficult time with dentures. So yes, they've gone to a number of people and they haven't gotten satisfaction. And those are the treatments that I get tremendous satisfaction as they come in with that bag of dentures, or they've had a couple of bridges done and they come in and finally we're able to give them relief.
Now, do you know when you have a patient like that, do you know before you start, in other words, can you look at their old dentures and know, okay, I'm going to be able to make this person a new good denture, or their old dentures were good? Like, how do you avoid making them another set of dentures that maybe they're not going to like?
Well, I take a very high priority in that and I see lots of people who come to me with that kind of advice. And one thing I always tell them is I tell it like it is. And if I feel I can help them, I will do everything in my power to help them. But one of the best things I can do for somebody is if I look in their mouth and I see that they're what they've had is acceptable and they're just for whatever reason they're not able to handle it, or they're not able to be comfortable with it, I will tell them right away that I just can't help you. Fortunately, that's not a lot.
You would think that a denture is a denture is a denture. I mean, is there really such a difference in the difference in the construction of a denture, between, say, a $2.95 denture you'll see advertised in the newspaper and maybe a denture costing thousands of dollars? Is there really such a difference?
That's a good question too, because once again, it's relatively easy to make dentures okay, but to make dentures totally fit a person and rebuild their smile, rebuild their bite, especially when you use the finest materials, some of the teeth we have today can look absolutely beautiful. And so someone came in to me today and yesterday, and they asked me, I'm a candidate for dentures. I'm afraid of what I'm going to look like. I feel very confident knowing that with the new modern materials that we have these days, the teeth are beautiful. We spend the time that needs to be done to make it exquisite, and that would be the difference.
Did you ever get somebody, is this common that somebody comes in, they just hate their denture, they hate their appearance, they're sunken in, you make them a new denture and it just totally changes their appearance and changes how they feel?
Yes, it's actually true. Just the other day I had somebody come in, and they couldn't exactly say what it was, but they've had a number of dentures made, and they were eating okay, and they felt okay, but there was just something missing. And someone had told them about our office, and they came in, and we made new dentures, and when I gave them the mirror to take a look, their eyes lit up, and they were saying, I could smile. I had a feeling I could be like this, and I could now smile more than I ever had, and better than I ever had.
You know, it sounds, when we started talking, it sounded like your office is almost like you're the dentist of last resort. When someone hasn't been able to have a satisfactory result at their regular dentist, they would see a prosthodontist. But as you're talking, it really sounds to me like it makes a lot of sense to see a prosthodontist from the get-go, to really have it done right from the ground up and have it be analyzed. Almost like having a master builder build your home versus, a contractor who's a good contractor, but maybe is just starting out or doesn't, build homes, maybe does renovations more frequently.
That's absolutely true. And what I like to do a lot of times is compare it to the medical model. There's people who have problems, heart problems, high blood pressure. They'll go to their general practitioner and they'll get treated, where other people, they want to go to their cardiologist. Other people have diabetes. They feel comfortable going to their medical doctor, but other people they want to go to the specialist, so they see the endocrinologist. So that to me, that's similar to a prosthodontist.
Mm-hmm. We're going to take a fast break. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back, and we're talking with Dr. Ron Haas. Dr. Haas is a prosthodontist, one of only 1,000 or 1,500 prosthodontists in the country. So we spoke a little bit about how patients come to you. What are the most common ways that patients find you? Do they all find you out of desperation, or do some people seek you out from the beginning? How do people typically get to your office?
Well, one of our goals is to let as many people know as possible that we are available, because if I had a dollar for every time that someone said, oh, I wish I knew about you sooner. We hear this constantly. I wish I knew about you sooner. I wish I knew about you sooner. Therefore, what we've done is we've placed some ads in some local media, some local newspapers. We have a website. It's difficultdentalproblems.com. And what we try to do is we want people who are looking to get satisfaction to be able to find us. Unfortunately, that's been working nicely.
People really pick their dentist from a newspaper ad?
Believe it or not, I never thought myself that would work, but I've done it in such a way that it's of course we want people to come in, but it's almost like a public service announcement. I want people who are having problems, who've never had satisfaction, to know that a prosthodontist is available, because most people just don't know that something like this is available.
Yeah, a lot of people maybe like their general dentist or like their family dentist. They've been taking care of them for a long time, but I think it's hard for anyone to know what they don't know, and it's hard for any person to know, okay, this is sort of my limit. But it sounds like you're saying a lot of general dentists recognize the level of training that you have and end up referring you patients when they feel it's beyond what they can accomplish predictably.
That's absolutely true, and there's a number. Fortunately, I was checking today, we have hundreds of general dentists who have sent us patients over the years, and they do recognize their limits. Now, it's very few, which is nice to see. So it's actually the dentists who do send patients are not the worst dentists. Frequently, they're the best dentists. And they know that 1 or 2 times a year or more, they will have someone who just needs that specialty care. And that's number one. Number two, what I like to do is actually we have a lecture that I'm planning. And I'm gearing it towards the general dentist. And one of the things I want to do is let the people who don't know their limits, don't know as much when to refer. I want to let them know when to refer.
You have to give a general dentist who refers you a patient a lot of credit, because if they didn't care about their patient, they would just muddle through and do the best job that they can and maybe have a mediocre result, maybe have a good result, maybe have a poor result. But when you have a dentist who in effect says to a patient, spend your dental dollars somewhere else, go to this guy, he can help you better than I can, I think you have to give that dentist a lot of credit for his ethics and his integrity.
It's absolutely true, and consistently I hear from the patients who do come to my office. Not only aren't they upset that they have to go to another office, at least 90% of them are actually complimentary. They say they think that the dentist was acting in their best interest. They're very appreciative of that.
So what are the most common problems that you see patients come in with who are seeing a prosthodontist?
Well, as I was saying, the most common problems are people who have problems with many, most, or all of their teeth. There's 5 main ways that people get these problems. People with massive amounts of decay, people with massive amounts of gum disease, people who have genetic problems, teeth maybe didn't come in, teeth came in defective, people who get into accidents. And the last one is people who have habits, harmful habits. Many people grind and clench their teeth. They could bite their nails, bite on objects. Sometimes they have acidy foods, and that can destroy their teeth. So all of these people are compromised, the people who do come to see us.
Mm-hmm. So each of those people sounds like they really have unique needs, and you have to approach them in a unique way. It's not that the same crown would be the same crown that each of those people would get.
Absolutely. And on that note, what I think is the biggest benefit from the prosthodontist as a specialist is first thing is diagnosing the problem. That's one of the things that separates us apart, is diagnosing the problem correctly, which is the main way to know how to treat the problem. And then the last thing is to monitor everything and make sure that any complications are taken care of.
I would think that when you see a patient who has failing dentistry, that you must really take a step back and ask yourself, the knee jerk for the untrained dentist would probably be to say, okay, this dentistry is failing, let me replace it. But I would think you take a step back and try and understand why it's failing and what you're going to do differently or why it failed so that the new restoration lasts much longer.
Absolutely. That's one of the most important things. And that's one of the things that we do in our 3+ years of training, is to be able to figure out, not just to see, it's not just about doing a crown, doing a bridge. It's about seeing what the problem is, figuring out what made the problem, and figuring out how to make it go away and keep it away.
A lot of people have it in their mind that it's really the lab that makes the denture, or the lab makes the crown, and the dentist is sort of the intermediary. But that's not really the case. I know we were talking beforehand, and you were telling me a little bit really about how important the lab is and how you've incorporated that into your practice. So let's first talk about who really makes the crown and who makes the bridge.
Absolutely. These days especially, it depends where your lab is. Some laboratory work is actually done in China. Okay? It could be done well, but the best way to have a lab is to have a lab either in the building, in your office, or nearby. Which is one of the things we have. Is we're able to go there. We have our lab right on the premise, and I'm able to go there, see what's going on, help direct what's going on, and to prevent actually what you were talking about, which is just sending it to the lab and saying, okay, let the lab do it.
Mm-hmm. So does your lab technician actually interact with the patients at all? Does he have a part in that end of it?
Absolutely. In our lab, actually, we use Oscar's Dental Lab. And 3 days a week, he's actually on the premise. And it's a great advantage, and the patients actually appreciate it very much, and they see how it enhances their result. He actually is able to come into the room, look at the dentistry right in the mouth. It's totally different when a lab technician is able to look at the teeth surrounded by gums, surrounded by a person, than just the model.
So how is it typically done in an office that doesn't have a lab in-house? How does the typical dentist who sends his lab work out take our listeners through that process of how does the lab technician interact with the dentist and the patient versus what happens in your office?
Absolutely. I would say approximately 90% plus of the dentists will do whatever needs to be done, do an impression, send it out to the lab. The lab is at some distant place.
So the lab technician never sees the patient usually?
Never sees the patient. They may see pictures, which is one of the advances we've had. They never see the patient, and it's done, and then it's shipped back over many miles. If anything needs to be redone, one step needs to be redone, it's another shipping and another return.
So the dentist writes out a prescription, make it this shade, maybe shade it this way, but it's like trying to describe a sunset with words as opposed to saying, hey, look at that sunset.
Absolutely. We're fortunate where we are, whereas I've seen in journals, there's a lot of time spent on how to get your lab communication proper so that the miles aren't a bad thing, but fortunately, we don't have to deal with that.
I would guess it's a big time saver for the patient as well.
Absolutely. One of the biggest advantages is patients come in and they have a time limit. They have to leave town in 2 weeks. They have to have something done in a week. They have a wedding. They have occasion that's coming up in a week. Having the lab on the premise allows us to get things done much, much more quicker.
So why doesn't every dentist have a lab in their office?
It's actually it's costly, and it's difficult to find the right person. Mm-hmm. Like I said, we use an independent lab, but he comes on the premise 3 days a week, and once again, most labs are not able to do that. They treat many different. They service many different dentists, and they're usually in a faraway location.
So it sounds like a real partnership between you and the lab technician, both producing the restoration for the patient.
Absolutely, and that's the best way to do it. In prosthodontics, it could be one of the most frustrating things is everything is not under your control. You have to depend on a lab person, but when we're able to control it this way, it works out beautifully.
It must be very satisfying for the lab technician also on these, difficult cases or aesthetic cases when he sees his work go into the patient's mouth and everybody gets that positive reaction. Because I would think the average lab tech never sees their work in the patient's mouth.
Absolutely, absolutely. When Oscar comes into the room, he's able to see what's going on. The patient's actually able to express their appreciation, and absolutely most lab techs do not get that. It's absolutely true.
So do you think that the quality of your final result, aside from the convenience, which sounds tremendous in terms of saving time for the patient and the convenience for the patient, do you think the end result is better in your hands having the lab technician in the office than otherwise?
The quality issue is huge. Just by being able to see if something's not 100% right, communication is not an issue. We're able to have them come in, take a look at the color, the shape, how it fits into everything, how the bite is, and then just seeing. A picture is worth 1,000 words, and seeing in person is worth 10,000 words.
When you started to talk about having a lab tech in the office, one of the things that you mentioned is that it's costly. And I'm wondering, you have all this extra training, and if I was a patient with a difficult dental problem, I would think, boy, it's really got to be much more expensive to have my treatment done at a prosthodontist. So, is it so much more expensive than a regular dentist? Does it end up being less expensive in the long run? What should people expect?
Okay, well, it may be more costly than the average dentist. What it really comes down to is value. Getting it done correctly the first time, getting it done right, getting it done comfortable, and having it last is the most important thing to make it.
Have you seen that a lot of people spend a lot of money on dental work and 5, 6, only a handful of years later, what they thought was such a good deal wasn't such a good deal because it had to be redone?
Absolutely.
Is that common?
Unfortunately, it's very common. Actually, the second most common treatments that we do is redoing dentistry that was done by other dentists who just either didn't know their limits or misjudged. So it's more common, unfortunately, than we think.
Do you think some of that is the execution on the dentist part, knows how they actually did the work, or is it sort of their diagnosis and maybe not having the training to understand why things broke down in the first place so that the solution is a durable solution?
I definitely think that's part of it, and it's because I teach in dental schools, I teach in the advanced training programs. I know what's included, and I know what they're just not able to get to figure out some of those more difficult diagnoses. So while the dentist is doing everything to the best of their ability, sometimes these cases get more difficult, and it's just you get a complication that you're just not able to handle.
There was I don't remember where I read it, but it was a surgeon saying that he could teach somebody how to take out an appendix in about 15 minutes, but it takes 7 years to teach them what to do if something goes wrong. And it really sounds like that's the situation, to know how to handle those complications and the landmines.
That's absolutely true, and actually the best comparison that I have found is when someone's going to have a baby and they have an obstetrician. A basic delivery of a baby, the cab driver, the policeman can do a beautiful job. When something's not going right, when something's a problem with the cord or anything wrong with the baby, that's when you want that highly trained special obstetrician to be there. High risk.
You want that expert.
You want that high-risk obstetrician there. While we're not as critical as delivering a beautiful baby, it's like having the high-risk prosthodontist.
Well, but the end result is still the same. I can imagine how frustrating it is for a patient to spend 6 months, a year, 2 years at a general dental office trying to get a case finished. Finally, it gets done. Everybody's relieved it's finished. Then only a few years later, they have to redo the case. I would think that and correct me if I'm wrong, but I would think that the average patient maybe who comes to you who's had big reconstructive work done at other dentists and that didn't last or it didn't hold up, that they're sort of disgusted and mistrusting of dentists altogether and hesitant to take that next step to redo.
That's absolutely true. But what I have found is that the vast majority of dentists do what's up to their ability. I see many beautiful bridges that are done by dentists, even big bridges, full arch bridges done by dentists. So most dentists do a beautiful job. It's just it's that small percentage where it's not done up to the best standards, and the patient's frustrated and the patient's unhappy, and where it could have made the biggest difference.
What do you think for people listening maybe that have pretty difficult dental problems or advanced dental problems, and maybe they've seen a dentist recently, maybe they haven't been in 20 years, what do you think are the biggest barriers that keep people from picking up the phone and coming in and seeing a dentist and getting their mouth in shape?
What I found, most people, probably number one would be fear. A lot of these people they're afraid of getting the treatment done for whatever reason. I think they're thinking about old-fashioned dentistry. The modern dentistry is much more comfortable and easier than what they might have in their mind. The second thing is cost. And once again, even though, like I said, the cost could be a good amount, the value is tremendous, and there's many ways, including spreading the cost out over time, that could make even the best care affordable to most people.
Really?
Absolutely.
So people don't have to. There's no mystery. In other words, when they start these cases, do you pretty much give them a close idea of what it's going to cost, or does the cost sort of unfold as the case goes on?
I've seen it done by other specialists both ways. And what I like to do, because I know I like certainty, I like to give patients certainty. So I do in 99% of my treatments, I evaluate what needs to be done, and I will give the patients the details of what will be done, what the cost will be, how long it will take, and so they know up front what the cost would be.
What's the process like? Walk me through. Let's say I'm a new patient. I hear you on the radio. I want to come into your office. What can I expect in terms of our visits and up to the point where we get started? Is there much discussion, or how does it all work?
What I do is I have the patient come in and I do a comprehensive examination. I examine all parts of their mouth, look for decay, gum problems, bite problems, etc. I will take some photographs of their mouth. We'll take X-rays. We'll make sure we have all the information. But the most important thing I do is I will listen, because it's amazing. I learned this in my hospital residency program from medical doctors and dentists. Is when you listen to the patient, that's when you find most of the answers. So the most important of my examination is listening. Then I do the technical work of examination, working up with models and photos and things like that. But the most important thing is listening and getting the specific specific solution for that patient.
So how long is that first visit usually? 15 minutes, half an hour? What does it usually take?
We schedule 30 to 60 minutes for the first visit. As I said, sometimes we'll get what we need, and then most of the time we will get the patient back a second visit. Between that first and second visit, I will sit down with the X-rays, all the models. Sometimes we'll do work in the laboratory to work up what their smile should look like. We have photography. We actually have an advanced computer program that can actually work up what the patient may look like after everything is done. Once I figure out what's the best way to go with alternatives, they'll come back the second visit. All we'll do is sit down and talk. I'll answer questions, and we'll give them the opportunity to get answers.
That sounds like a very different dynamic than most people are used to. Most patients I talk to, they're sitting in the chair, they had their teeth cleaned, the dentist comes in, they say, you need 14 crowns, go see Sally at the front desk. But it really sounds like it's a much more interactive process in your office.
Yes. I've heard that from many patients. They come and say, they go, wow, this is the first time anyone's ever asked these questions. This is the first time anyone's ever listened to me for this period of time. So,
what do people typically say when they finish their case? They've been embarrassed, or they're hiding their smile their whole life. What are some of the reactions you get from people when they're done?
One of the most common reactions is wow. One of the second most common reaction is, I really wish I knew about you and I knew what a prosthodontist was years ago, before I had this done, before I waited so long.
And, we've spoken so much about those difficult dental problems today, but, we spoke about the baby analogy. There's no harm in having the most expert, high-risk OBGYN deliver your baby, even if you're having a normal delivery. So do you do dentistry just for regular people who have the average problem, or is it only the difficult problems?
No, it's very true. While we don't seek out the simpler care, certainly we have friends and family that's referred to our office. We will do fillings, we'll do cleanings, we'll do someone who needs a crown or two. So we're available for all kinds of treatment. But most people who do come to us have more difficult problems. But like you said, people who just want to be seen by a specialist, we're there for them too.
We have to wrap up very quickly. For anybody listening, how can they get in touch with you? Where's your office? I didn't even ask you.
We're located in Deer Park, New York. We're convenient to the highways. We actually put up a website. People can search us on the web at difficultdentalproblems.com.
And what's your phone number?
Is 631-243-2929.
Excellent. Well, Dr. Haas, I want to thank you for being on the show tonight. This was a very interesting show. I want to thank everybody for listening. This is Dr. David Scharf. You've been listening to Healthy Living Radio, and we'll be on the radio again next week. Talk to you then. Bye-bye.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.
expressed in the previous program did not necessarily represent those of the staff, management, or owners of WGBB.